Here at MUSC Children's Health, we have a pediatric concussion clinic where we treat children from all ages, early preschool all the way through their high school graduation. We have a specialized team here that will treat patients with newly sustained concussions as well as those that maybe experience prolonged post-concussive syndrome. Our goal here is not only to provide medical management, but also guide them with return to learn and return to sport or play protocols. So we will see them here in clinic with not only a pediatric neurology provider as well as our therapy providers. We can also refer your child to additional specialists if they're needed.
Concussion is a mild traumatic brain injury that can be caused by a fall or direct hit to the head or an injury to the body that causes the brain to quickly move forward and backward within the skull. One thing to know about concussions is there's not always a loss of consciousness and it's not visible on scan, so it's important to be aware of the symptoms of a concussion. Symptoms can include headaches, nausea, dizziness, sensitivity to light and sound, memory changes, changes in attention, irritability. It can affect your sleep, as well as result in a decreased tolerance to exercise.
So after the neurology provider performs their evaluation, the speech-language pathologist performs a cognitive communication evaluation. That looks at basic communication skills as well as cognitive or thinking skills. This includes attention, processing of information, memory, and executive functioning, which is higher level thinking skills. Following that evaluation, recommendations are made that may include adjustments to routines or schedules, accommodations or recommendations for the academic environment, or even a referral for ongoing outpatient speech-language pathology services.
In the physical therapy assessment, we assess the patient's ocular motor system, or how their eyes are moving, their vestibular system to assess how they're tolerating movement, and their balance, all of which can be affected by a concussion. I provide the patient with a home exercise program and guide them through a return to exercise while they're here, and recommend outpatient therapy as appropriate.
The speech-language pathologist also manages the Return to Learn program. This may include adjustments to the academic environment itself, as well as modifications to the amount of work or the level of work that the students are performing. Our goal is always to get them back to school as quickly as we can, while ensuring their brain continues to heal and isn't overwhelmed.
Following our assessments, we will discuss our findings as a team and determine the best plan of care moving forward for your child. And then the neurology provider will come back in to review the plan with the family.
If your child was injured by a small bump or a big blow to the head, you should consider seeking an immediate evaluation. Your child's pediatrician or an emergency department locally can do an initial evaluation if you're concerned at all for your child's symptoms. But afterwards, the MUSC Children's Health Concussion Clinic is just the place for you to give care to your child who may have sustained a concussion.